Good morning, everyone. Today we are going to talk about the peripheral blood smear, that is the general blood picture that is advised many a times when your hemoglobin is low or there is some defect in the formation of RBCs, WBCs or platelets, or whenever there is a chance of infection by a hemoparasite, or sometimes even as a general checkup. We go for the general blood picture, and in this general blood picture we see for the three lines, that is the red blood cells, the white blood cells and the platelets. The red blood cells, normally we do not find any immature cells in the general blood picture, but whenever the hemoglobin is low, which might be because of usually the iron deficiency anemia, or sometimes because of hemolytic anemia, we see the immature forms of RBCs, that is the normoblasts, which are basically three types: the early normoblasts and the late normoblasts, and sometimes the reticulocytes, which might be seen in the general blood picture. Other than this, we can see various types of hemoparasites like the malarial parasite. Its various forms can be seen in the RBCs. So RBCs are to be checked for their size, for their shape, and for the anomalies, or if any other abnormal material is present inside these RBCs. Then we come to the WBCs. Sometimes the TLC, that is the total leukocyte count, may be very high, or sometimes it may be very low, and both the conditions, they are seen in a large number of cases. So we have to rule out whether the TLC comes in the normal range, that is from 4,000 to 11,000 in the adults, or sometimes different values are seen in children and neonates. Other than this, we look for the immature forms of WBCs, that is the lineage of both the myelocytes as well as the lymphocytes, which might be seen, along with some monocytes which may be increased in number more than the normal, or sometimes we look for some cells which are normally not seen in the blood picture, that is the basophils might be present if there is some type of leukemia or any other condition. The basophils might be present in the blood smear. Then we go for the differential leukocyte count, in which the different types of leukocytes, that is the polymorphs, the lymphocytes, the monocytes, or the eosinophils, they might be increased in number in various conditions. And this tells us about different types of diseases or different type of maturity of the WBCs, which might be observed in the general blood picture. Then we go for platelets. The platelets might be low in number. Then it is a condition known as thrombocytopenia, which may occur because of many other diseases. And sometimes the platelets might be increased in number. But more important is the decreased number of platelets, and many a times abnormal platelets might be seen in the general blood smear. Now, coming to the hemoparasites, mostly we see the malarial parasites. Other than this, sometimes the other type of parasites may also be seen, which infest the RBCs, like the LD bodies, etc., which is quite rare. Other than this, we have to look for any other abnormality from the normal range in the general blood picture. If any abnormality is detected, one must go for higher tests like the bone marrow examination or flow cytometry or many other types of hemocytometry tests that are available for us, and come to a diagnosis. For this, we might have to refer the patient to a higher center. Thank you so much.